So, what are the causes of not passing MCCQE1? Like, I have talked to like couple of people. I won't say like more than 10 people, and I come up with few like common things that most people say. It is basically not enough time, not able to understand question, because most of the time they think this is what they are asking for, but the question is quite of different. They are confused, like 50% might be asking this one, might be asking that one. Mostly problem having a CDM question, vague questions. They don't know if they were asking for a counseling or they were asking for what you need to write down, either an investigation, because they just write down what is the next step you will do. So that is kind of vague. So some people just don't even understand, like, may I have to admit that patient, or I should start with investigations, or should I save this patient? What should my next step should be? So kind of vague question, too much knowledge, like our knowledge is too much according to the paper, and it's not like much organized, so we don't know what to write when we know there's like five options and we think two are correct, and even those two are correct, but we have to choose the best one. Like, we have enough knowledge, but the problem is which one should be the answer. So hard timing deciding what to write in CDM question, like what words should be good enough, writing down offer, writing down giving the treatment. So those are the quite common words, but obviously people make mistake and those are not chosen as corrected. So then coming to the everything seems right, like when you are solving the questions you feel like everything is right, this is right, this is right, but obviously one option is correct and one option is not correct. And obviously more questions that people might come across, but I don't like come across most of them. So these ones are the basic thing, and we'll try to discuss all of them one by one. So let's talk. Like, if you have already know where your problem is, right, then you should look on to that particular problem and try to solve that one. But let's suppose if you don't know what your problem is and you ended up failing it, now you don't know what was your problem. Was the problem knowledge? What was the problem, CDM question? Was the problem with me, or was it with understanding it? So these kind of questions, obviously, some people think of might be like, so kindly mute yourself, everyone. That would be really nice. So these ones, these are the questions. So what should we do next? Is my knowledge not enough? A lot of people think like after giving the exam, failing at like, obviously passing marks is 226. So if somebody failed at 225, so is the knowledge not enough? I would say no. Your knowledge is enough, but your way of tackling it, that answer is not enough. So important thing is your right set of mind. Remember, there is no shortcut for things like these. Like, people think there is big nine or top 100 topics. As I keep on mentioning, in 210 MCQs, do you guys think they will just touch those top 10 or top nine big topics, or top 100 topics? Obviously they are going to touch every single aspect whatever is given in MCC objectives. So what you can do is, there is no such thing called like important topics. Obviously what is given in MCC objective, everything is important. Believe me or not, whoever has given exam, they can tell you that in MCC objective everything is touched either in MCQs or either in CDM. You cannot tell, like, basically emergency is being tested. You can see a lot of peds is being tested, a lot of geriatrics, a lot of internal medicine questions are there. So everything is touched here and there. So make sure you do know everything little by little. You don't need to go in very detail of everything. So just know the basic things, and importantly, MCC objectives. So your approach is not Toronto notes, but MCC objective. Let's suppose if somebody had read all the Toronto notes and still couldn't able to pass it. So remember, even the whole Toronto notes is not enough. You need to know MCC objective. A lot of things in the Toronto notes is not important, because everything is precisely written in MCC objective, but not everything is written in Toronto notes. So it's going to be tested. So everything which is written in Toronto notes, it doesn't mean that it's going to be tested. Even in those like emergency medicine, family medicine, a lot of topics over there is like written because that is covered in emergency, but it doesn't mean that those are important as well. So try to see MCC objective and mark them on the Toronto notes and then do Toronto notes. Just don't directly start doing Toronto notes. I know it will take your time, but just spend one day in taking out Toronto notes topic, MCC objective topics, and marked on Toronto notes. It will take only hardly 1 or 2 days. But believe me, it will be worth it till the very end. you will see there is so many topics in Toronto Notes that is not even important and you are doing it. So whatever is in MCC should be covered. You cannot miss anything. 210 MCQs, believe me, everything is touched. In 38 CDM questions, there are 3 parts in that. Everything is touched in that. So just consider that. Now let's talk about time management. Some people like think that there is not enough time for them to solve all the MCQs. So try practicing. What I would offer is try solving 10 MCQs per day, then increase your limit, maybe starting from 10 MCQs per day in one sitting. I'm not talking about you are doing one MCQs and moving around. No, in one sitting, try doing 10 MCQs, then the next day, try doing 15, then the next day, try doing 20, 30, 40, 50, and take it to 100 MCQs per day in one sitting. It will not just build your knowledge, but it will also build your stamina. A lot of people get distracted after solving 50 MCQs. So when you are doing 100 MCQs, remember, if you are doing 100 MCQs for last 100 days, or maybe in 50 days, or last 20 days, you will stay concentrated at least up to 70 MCQs. Obviously, we are human, so we cannot concentrate much. But if you build your stamina that way, your knowledge is good, but now you will be concentrated more. So try to solve many MCQs in one sitting. There is no such thing you are solving 100 MCQs per day. Try solving 100 MCQs in one sitting. I'm not talking about per day. I'm talking about in one sitting. Your goal is that I'm going to sit here, I'm going to solve this much MCQs, and then I'm going to get up. Believe me, whoever solved 100 MCQs per day, they still believe that the time management was not good enough. So per sitting is very, very important. It will help you to save a lot of time, and along with that, it help you to save a lot of time management. You will know where you can save time, and you consume a lot of time in the other way. So try to save MCQs in one and time in one MCQs. Let's suppose you know this question. Don't just spend time. Oh, it could be B, it could be C, it could be D. You saw MCQs, you know the answer. Try to find out in the options. If you couldn't find it, then see what they're asking for and try to see it again. And then try to exclude, skim and scan. There's so many methods in solving MCQs. Try to put on every single method, whatever you know, and try to solve it. But if you know this is the answer, don't just C, B, C, D. Most of the time, whatever you thought at the first is the correct answer. Like it happens to me a lot of the time when I try to correct B, and then I saw it again. I feel like, oh no, this should be C. And believe me, whatever I'm thinking the second time, it's wrong. The first time you are thinking is correct. This is also one of the very important tips I would say, that whenever you are solving a question and you feel like this is the answer, and then you saw other options and you got confused, believe me, the whatever you saw first is the answer. It happens to everyone. If it doesn't happen, then obviously there might be exception as well. So use that time in different MCQs. So there is one of the things that I would say, if you have enough knowledge of solving one MCQs, don't spend too much time. Like you have to spend 1.5 minutes. No, you have to spend 30 seconds over there. Maybe you can save that time and spend it on the different MCQs. Flag questions. This is also okay. People got scared, like if I flag the question, I might not be able to come back. It is totally okay. You might be able to get enough time in the end to solve flag question, but at the same time, keep on looking at the time after like 10 minutes before or 20 minutes before, go to flag questions. Come back and solve those flag questions. Do calculations in the end. People, what they do is when they are solving public health questions, they start calculations right away along with it and ended up stucking like 5 minutes, 30 minutes on that particular calculation. And they don't even know, because they are so stuck in solving that calculation, they don't even know how much time they are spending. So what my suggestion is, flag that question, come back and solve it later. So this is a very nice thing to do. And then other than that, try to highlight important words. If you see, try to highlight. Like let's suppose you are seeing this is the age, this is the patient, this is the is she pediatric or is she a geriatric, coming from where, coming at which setting, what is she presenting. These are all the important highlight points. What you can do is you can highlight it once, and when you are looking at the second time, all you have to do is look at those important points. It will save a lot of time. Believe me, it's so easy to highlight all those important points, and it will save a lot of time for you and easy to solve the question. Even if you feel like you want to write it down, just write it down, because sometimes the description is so long, you have to scroll up and down. So my opinion is, write down, you have a paper over there, write or whatsoever, and then see what is given in that, and you can solve the question. Then testing your knowledge before exam. So people do is like 10 days before the exam. I mean, this is not the right way. You shouldn't be doing. So what you should be doing is, at least before booking the exam, test your knowledge. If it's 70%, 80%, 90%, or whatsoever, even 60%, it should be at least 70% when you are about to book the exam. This is one of the things that I should be highlighting here. Totally up to you. It's not like that, but don't test your knowledge just before 10 days of the exam to have, or you have already booked your exam and now 10 days are left, you are testing your knowledge. Believe me, this will just freak you out, or you will be like getting panicked. Oh, my scores are not coming enough. Before booking the exam, test your scores and then book the exam. That is very highlighted thing. But if you still already booked the exam, you are going to test your scores, this is also good, but don't test it before 10 days or 20 days. This is not a very good way. Believe me, you will be in the exam that my score was not good enough in the exam, so it will be not good in exam. So please kindly consider this thing, very, very important. So you can book even 7 days before the exam. You don't have to book it like 10 days or sorry, 3 months or 5 months. When I was booking the exam, I wasn't confident enough. So I booked it like 10 days before the exam. So you can book it anytime until the seat is available. I mean, it's totally up to you. So read an MCQs not more than 2 times. In the first read, highlight important points. So in the second read, what you can do is see the highlighted points. So no, don't read MCQs more than 2 times. What will happen? You keep on reading it, but it's going from the top of your head. Just leave it, flag it, move on to the next one. If you spend too much time on one MCQs, it is very, very dangerous thing. Believe me, you won't be able to solve 210 MCQs if you spend more than twice reading one MCQs. That is like a hell no for this. In the second read, go through the whole MCQs again and mark it. Okay, just mark it. Or if you are not feeling like this is not the answer, flag it and move on to the next one. Maybe you later on decide, oh yeah, this could be the answer, and then you can come back and solve it. So it is totally okay. What you can't solve it, flag it and move on. Move on is one of the things, is very, very important. It's totally okay if you cannot solve it, just move on. Because just because of one MCQs, you don't want to mess up other 50 MCQs, right? So move on is very important. Then moving on to the next. Now those people who have given it like 2 to 3 times, like, okay, somebody who has given it 1 time, hard luck, totally okay, try to do it next time, like totally fine. I mean, even somebody who's doing it for the first time, like 1 time he failed it, or even doing it for the first time, this what I'm going to tell you next, you can, everyone can do it. Okay, so it's not just for the people who are 2 or 3 times and couldn't make it. Even for the first time you are doing it, or the who have already failed it 1 time, they can do it everything. What you can do is, my suggestion is, try doing NAC first. Try to stop doing MCCQE1. Let's suppose people said, oh, I will do MCCQE1 and now I will do NAC. What they have given us the option that it's okay if you don't have given QE1, you can give NAC, right? So this is also one of the very good opportunity that I would say. What will happen when you do NAC? Your approach, your vision will broaden up. You will see how different it is when you were studying for QE1 and how different it is when you are studying for NAC. A lot of questions like counseling, a lot of history taking question, a lot of investigations will be covered in NAC. How you are approaching in that, it will be very, very easy. Whoever is giving it for the first time, second time, third time, fifth time, it's totally okay. Whoever fails it, it's totally okay. Just change your approach. Like you are taking a straight path, now you are going to take a zigzag path. It's totally okay. The destination is same for everyone, right? You are going to end up getting cons or whatever program. Your approach is passing both the exams. One was taking it first, second, now somebody's taking it second and first, is totally okay. Whoever is doing it, my suggestion is take NAC along with it. Slowly, slowly, what will happen? Your vision will broaden up. You will see how you are taking a NAC. If you have ever in a practice NAC with somebody, you will see how different it is when you are just doing QE1 and how different it is when you are doing NAC along with it. My total suggestion is do along with it NAC. It will help you to solve CDM questions. Believe me. I mean, who have already been taking exam in the next month or second month, totally okay. It's totally fine. You don't have to go out of your way and now doing NAC. But NAC is something which will help you broaden up your vision. You cannot pass QE1, you lose confidence, do NAC. This is also a way of approaching. You might, like if you do well 3 to 5 months, you will do good NAC. Now you have confidence enough and sit in QE1. And believe me, that confidence will help you to go through this QE1. All you need is confidence, because people who have given 2 or 3 times, they said like, oh, I couldn't able to make it. It's totally okay. Believe me, when you just change your path, when you were just going straight, now you're going zigzag, it's totally okay. Okay, just focus on QE1. Even if you are doing it for the first time, you can take along with it, like on the weekends you can practice with someone NAC. What happened is, like when you are giving NAC or practicing NAC, a lot of CDM questions, you will be like, oh yeah, this can come. Maybe in this exam when you were sitting down, you feel like that, oh yes, when I was doing NAC, I saw this one, I should be saying this one, I shouldn't be saying this one, I should be asking this one, I shouldn't be asking. So many of your questions will come clear in front of you when you are solving the question. So this is one of my suggestions. I feel like I should share it with you. It's totally up to you if you want to take it or not. Obviously, everyone has a different opinion about it, but this is my opinion, and I feel like it will help you a lot. Believe me. Is it okay just doing right after solving NAC 1, give QE1? So a lot of people ask, if I give QE1, can I take NAC just the next month, like taking QE1 in September, might be taking NAC in September, and then should I take QE1 in November? I mean, this is, you have, if you have been preparing QE1 and NAC along with it, then yes, you can take it. But let's suppose if you were just preparing for NAC and then directly jump into QE1, QE1 is more than that. Believe me, NAC is not enough for you to pass QE1. You need to study for QE1 to pass QE1. Okay. So if not, then QE1 is little different, little more elaborative exam than the NAC. NAC is something comprised. They give you some specific topics. You have to cover them. But QE1 is little more than that. So you might be testing a lot of your information, knowledge other than NAC. So you have to see, if you are preparing both of them individually along with like morning QE1 evening NAC, then you can take it together. It's totally okay. I have seen a lot of people who have done it together, and obviously they scored a lot of good marks as well. It's not the end of the world. If you can manage, yes, you can do it. But if you cannot manage, don't take the risk. You don't want to fail it, right? So NAC is precise, but QE1 is more than that. So 210 MCQs and 38, you see the number. It is not that simple. 210 MCQs, you might think that this is going to be covered just with the NAC questions. No, they are going to see how you are going to approach, how you are going to test this patient, how your discussion is, how your counseling is, whatsoever. But NAC will give you an idea how to write down your answer, how to get your words that you are looking for to write on the CDM questions. When you are practicing speaking those words, what happened in the NAC, they will, you will get that idea. Oh, I should be using this word, elaborate. I should be using offer. I should be using this word, not just giving. Okay. So that will give proper time to QE1. Don't just rush it. Don't rush it. Okay. Both for QE1 and for NAC, they need time to study. You cannot just directly jump to the exam. Oh, I woke up one day and feel like, oh, I should be giving this exam, and next day you are giving it. No, this is not how it works. How to study along with job and family. So there is somebody who asked about this question. So you can study, like, this is my personal opinion, up to you what you want to do. You can study for 1 hour, take breaks in the between. That's what you can do. Or you can study continuously at night, like put your family or job aside, and at night take like 2 to 3 hours and study continuously. Or you might take breaks in the between and do study 1 hour, give your family some time, come back, do 1 hour again. So it's totally up to you how you divide it. Little sacrifice, but believe me, worth it. Like in the later future, you are going to do this for your family. They are going to be proud of it. So believe me, it's totally worth it. Little sacrifice, but it's going to be worth it. Take break from work for some time. Like let's suppose if you are working, take a 1 or 2 months break just before QE1. Don't take it for the long period of time. Maybe take for 2 weeks, 1 week. Some people who have been studying for the whole time and working along with it. My study partner, she was working along with me. I mean, I was also working at the same time. So we manage our time in the evening. and the morning she was also working and I was also working. So just before the exam, one day before the exam, I took the break. She took the break before 2 weeks. So it's totally up to you what you want to do. Like I was working, and work helped me a lot in these exams. In these exams, my work was everything that helped me to pass this exam. Believe me, my English, my way of solving, my stamina, my ethics, it helped me build a lot of confidence. I mean, I would totally appreciate my work where I learned every single thing, and yeah, motivation and everything. So my work was the only thing that helped me keep motivated and get through these both of the exam. So sometimes obviously work can help you a lot. So it's totally up to you. I mean, you can take break or you cannot take break. You just have to manage your time. Then coming to how to manage Toronto notes with the Q banks. This was also one of the questions somebody asked. I would suggest to give read. This is what I did. Okay. This is totally, your opinion could be totally different from my opinion. So it is totally up to you. I would suggest go read the Toronto notes or whatever the topic you are studying. Let's suppose you are studying emergency medicine. After giving a whole read to the chapter, like in 1 or 2 days, next 2 or 3 days you should be solving questions. You shouldn't be going back to Toronto notes. You did whole Toronto notes study. Now your next 2 or 3 days should be just solving the question. Believe me, whatever you studied in those 2 to 3 days, in these 3 days which you are solving questions, you will remember these ones, not those ones. So do a lot of questions. MCQs are so important. When you are going to sit in the exam, believe me, these are everything you are going to remember, not just the reading and everything. So for the revision on the weekend, what you can do is you have studied whatever the on the whole week, like let's suppose you are doing pediatrics the whole week. On the weekend, you can decide, okay, I'm going to do emergency, solve 40 MCQs of that. What will happen in those 40 MCQs? You will be able to cover all the psychiatry or whatsoever you are doing in that weekend. So it will help you to do a quick revision of that 40 MCQs. So you can do that. This is also one of my approach. Your approach could be different or your opinion could be different. Totally up to you. This is what how it works for me. So I work the whole weekend, whatever I'm studying, and in the weekend, my only whatever topic I have already covered the last week, I just don't want to forget it. So I solved MCQs of the 40, like 40 or 30 or 20, whatever easy for me, I made those. Okay. So you can make the set of those MCQs and try to solve it. What to do in the last 20 days before exam, that is also one of the thing. So this, do solve questions in the last 15 days. Your only thing is don't put new thing in your brain. Whatever you have studied, already studied. Now in the last 15 days, you cannot squeeze in anything. Believe me, if you try to squeeze new thing in your brain, you will keep on forgetting the past ones. So don't do that. Don't go through the questions people are posting on like on the groups. Most of the time they're posting the questions and they don't giving you the answer. This is making you frustrating more. So just my opinion is do questions along with their answers. Don't just do questions and you don't even know the answer. Believe me, if the same question come in the exam and you don't know the answer, what will you do? Just get frustrated. So do questions in the last 15 days. My total advice is like do so many questions that in the last 15 days it will help you to go through so many topics and your quick revision. Leave last 15 days for only question, and last 2 days just relax. You don't want to sleep in the exam. Last 2 days, take a break, sleep, chill, watch movie, whatsoever. Your mind should be relaxed because in the last 2 days you cannot do anything else. So if you try to put new things, you will just getting frustrated. At least last one day, sleep, relax, so your brain is super working in the day of the exam. That is my opinion. Whatsoever you can think of yourself better than that. So build your stamina in the last 15 days. It's very, very important. What to do about internal medicine topics? Obviously, people have, oh, why should I do a nephrology? They are not going to test me. Suppose if the patient is coming to you as a geriatric, what is geriatric? Geriatric is somebody who is old. Now that all the disease that is going to covered in old people, if they cannot have BPH, they cannot have prostate cancer, they cannot have UTI, obviously have. So why doing nephrology? Why just do geriatric? If you go to Toronto notes, you will see geriatric only have 3 or 4 topics, hardly. So nephrology is also part of geriatric. Nephrology is also part of some pediatric. UTI can also come in children. UTI can also come in adults. So nephrology is not just internal medicine, but it is also part of geriatric. Some people say, oh, 50% of my paper was covered in geriatric. But what was in geriatric? Obviously, 55% male was coming with you some symptoms. Those symptoms are coming from internal medicine. So internal medicine are same as weightage as any other topic. Believe me, it is not just internal medicine. You can just skip those one. Obviously there are important topics you need to do. You don't have to go through every single topic of internal medicine. Important topics in internal medicine. What are those important topics? Go through MCC objective, mark them on Toronto notes once for all. You're good to go. So you don't have to go keep on doing that again. There are a few topics very important in internal medicine. Do those more efficiently. If time, read others as well, but I would say if time. Okay, otherwise see in MCC objective, mark them on Toronto notes, do that given, and then do those ones. I marked on my Toronto notes, and that was worth for me. I marked every MCC objective topics on my Toronto note, and on the later time I didn't like keep on going here and there and there, what should I be doing from there. So I just did those topics. Okay, so it will be worth it till the very end. So you don't know, oh, okay, should I be doing this topic or not, or you should be asking somebody else. If you have gone through MCC objective, marked on Toronto notes, you are good to go. You don't have to go keep on asking somebody else and asking about the what should I do I need to study everything in detail? I mean, not in detail. I like elaborate in other videos how you need to study. I totally told you what you need to know, and the prevention treatment. Like you don't need to do like how you are going to do PSA for the prostate cancer. All you need to know is either you are going to do PSA or not, either you need to do prostate cancer surgery or not, what is the name of the surgery, more than enough. Or even if some diseases, you are going to refer to the surgery specialist. That's all. So don't need to dig in so much like how antipsychotics work, how this happens, how that happens. This is more than enough. I mean, believe me, knowledge is more than enough. If you keep on digging up, there is so much things that you don't even know. So remember, you are not a specialist. In every lecture I mentioned, we are only general physician, like a family physician or an emergency physician. Don't try to act like a specialist. We are not specialist. So our approach, our knowledge should be only up till a family physician know. If you, I'm just going to give you an example. If you go to a specialist, not specialist actually, you go to family physician, your own family physician. If you go and ask them, is banana good for my health? What is he going to say? I'm sorry, I don't know about that. What will, how about I study and get to know more knowledge and talk about it next time? If he doesn't know, I'm talking about just a general question. If he doesn't know what, how he's going to tackle it up. There is so many things that a family physician doesn't know, and that's why he's going to refer to the specialist. That's how your approach should be. You shouldn't be knowing everything. In our countries, the more we know, the more better doctor we are. No, it doesn't work like that here. Okay, so that's how the questions are going to be tested as well. So best book for NAC, I mean, Dr. Basil note was good enough, so there is no need to book 6 months back. Oh no, you don't have to book 6 months back. Which book? Clinical assistant. I wasn't doing a clinical assistant. You cannot do clinical assistant before NAC. Okay, so my job was like little into medical field but not into medical field. Okay, so when to do MCCQ bank during preparation. You can do it like in the middle, or you can do it in the start. People do it in the start, and what they do is try to see where they're standing, and you can do it along with their way, because MCC objective are there with you for the 6 months, so you can keep on revising it. Either you can do it just before 6 months, 1 month of your exam. That is also a good way. um, People say at least 3 months before the exam. Yeah, you can do 3 months. I mean, you can even do 1 month. It's totally okay. I mean, everybody has a different opinion. For me, I take it like 1 month before. So I took it like the whole last month. I was getting familiarized with what the words were written in CDM, so it was totally okay. Someone told me that the work in the clinic or hospital before appearing NAC, is it necessary? No, 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 no. I saw somebody who was working in a clinic and hospital and appeared in NAC, and she scored not really well. So now she's going to repeat it because she couldn't able to manage her time. So it was really bad for her. I mean, you know, that is not that is what of one of the example that is in front of me. She's one of my friend and she couldn't score well. So no, Can you please guide us about working along with the exam? What options we have before MCCQ? You can do, I mean, it's totally like obviously on the, clinic or your setting or where you are living. If there is any availability in the hospital or in the clinic or anywhere, and they are willing to let you work, it's totally up to that. I mean, that, yeah, it's totally that. I mean, that's what I'm saying. It's not 100% that you are going to get a job before QE1. You can look for the opportunities like volunteer work. That is also something you can do. Now I acted like a specialist in QE1, that failed me. Exactly. Don't act like a specialist. Believe me. I mean, we feel like we know everything. We want to write everything. We are good enough. We can treat everything. No, believe me, this is not how it works. Observerships are unpaid, and even if you are doing observership, it's not going to give much of your credibility on your CV. So volunteer work more than the observership. But if you're getting observership, why not observership? Will gap in the year after graduation after affect a CARMS pathway if someone has no job experience as well? Uh, I mean, I saw somebody who passed like 2007. After 2007, she worked for only 2 years, and then came here in Canada and start getting settled with the family. And now last year she passed all the exam, and not last year, but 2 years back she passed all the exam. So after that she started working, and she used that experience, and now she is matched in University of Manitoba. So anything could happen. So there is no such thing called you cannot get. There is nothing in this world that is impossible. Your main focus should be passing the exam. After that, believe me, there's so many things you can do to cover up whatever your gap was. So totally fine. Don't think of that because you couldn't pass it or you couldn't has an experience, you couldn't go for cons. You can. Why not? I mean, if somebody can, why not you, right? There is so many NAC courses that is going on. I mean, if you ask me precisely, uh, I mean, I cannot, I don't know if I can take the names here. I will, if you can ask me personally, I will write down in your chat box. Okay. So one request, doctor, can we get recording? Yeah, I will record this. Yeah, I already put it on the recording. So that's it. I mean, if you guys still have any question, you can ask me in the, what it says,